Welcome to Let's Talk About Health, an informational podcast that gives you insights on health and fitness from experts themselves that you can apply directly to your own personal health and fitness stories. Come join me today to hear all about what they have to say on health and fitness. Hello, you guys. Welcome to Let's Talk About Health by Bhavna. I am so happy and thankful that you guys have joined here today, and we're going to talk about health, about the practice, and so many more things, so many more concepts that need to be cleared, and people need to be educated about those things. So let me start by saying a big thank you to the both of you. And thank you for taking the time out and talking to me on my platform and spreading out the word so everyone can do better, be better, educate themselves, and just come meet you in Hoboken.
Thank you for having us.
Thank you very much. We're very excited to be a part of this and sharing our message and the message of all of us as well as health providers.
I love that. Since we're in I actually stay in New Jersey. Did you know that? In Jersey City.
Oh my gosh, we're neighbors.
Yeah, I know. That's why I was like, oh, I should have just gone by. But it was still close by. I'm gonna come visit though.
Yes.
But since we're in the tri-state area, let's talk about today's weather. It's such a beautiful day since yesterday. I love that.
Amazing.
2 days in a row. It's gorgeous.
I know. Let's hope it's the same. And without any delay, let's dive in. My first question to the both of you is, what, according to you, is health and fitness?
I'll let you go first.
Okay. So I know that by definition it's the absence of illness, but I kind of view health as a spectrum. So it's not just necessarily one thing. It's not just your physical being, it's your mental, social, emotional, and it's all of that together in one. So like on a spectrum, you can be really strong in one, but if you're not balanced in all, then you're not in like the best state of health.
Right. Makes complete sense.
Yeah.
David, what about you?
So for me, just really bouncing off of that, I definitely believe it's a functional spectrum. And really, to put it simply, it's just, what do I wish I can do? What can I do? And what do I need to do to get there? That's really health. It's a driven question. So It's different for everybody.
Right.
So for the 70-year-old grandmother, her goal is to walk to the ice cream store with her grandkids. That's the only thing that matters. That is her definition of health. To the professional athlete, it's how can I gain the competitive edge in the millimeters and the micrometers, and just to do whatever they can to help them get to the top.
Right.
And simply put, that's what it is.
Mm-hmm. How did you get into the healthcare field, just in health and fitness?
So coming from me, we both were college athletes, and I think we were just always surrounded by that team camaraderie with health and fitness. So it was very easy to stay active and to be a part of that when you're in a community like that. Yeah. And then as you tend to graduate, you kind of lose that part of your identity, that, student athlete, always having, to go to practice and to be in the weight room and all that stuff. So for me, health and fitness kind of shifted, and I really desired that community. I was always pre-med, so I wasn't sure necessarily what I wanted exactly in medicine, but what really helped me was practicing medicine and seeing medicine in different countries. I kind of saw that there's different approaches. There's approaches with nutrition and not necessarily just surgery and stuff like that. So with a little bit of time, I found chiropractic and I fell in love with it. So
it's great.
I love that.
She was so much more sure than I was. I knew that I was good. I loved science. I was always fascinated by science and geology, paleontology, archaeology, all those types of things. I was much better in my science courses than in history and geography. My geography teacher in 5th grade asked me, David, in one sentence, describe the Cold War as a pop quiz. And I actually said it was a war fought in the winter. At that moment, I said, I'm going to stick to science. And I love sports. And I always was in and out of the training room, not necessarily because I was injured, but because I really was fascinated in the science of body medicine. And that's where I got my kinesiology interest. And then I progressed it into where can I take the next step. And chiropractic really fell into my lap, and it's continued to evolve ever since then. And I couldn't be happier.
Well, you have a background. You have a very strong background of kinesiology.
Mm-hmm.
Why do you want to continue to pursue kinesiology or like physical therapy?
It's a great question. For me, it was looking at all of the different professions individually, and it came down to chiropractic being in a location where I really enjoyed. I love the state of Connecticut, and the University of Bridgeport is actually the first chiropractic school with a university backing. So I know that I would have a lot of exposure to their sports teams and some of the sports teams in the area. And as I became closer and closer with the development of chiropractic and how I understood how the spine and the mechanics of the spine work, I thought it meshed with my philosophy of body movement. And I thought it gave me a really good chance to learn a different side of healthcare and then to pair that with the two things that I love most. So it's been amazing.
I love that. You have the best of both
Yeah.
worlds. Well, I want to ask you, Cassandra, about your experience in, like you mentioned, you have a lot of experience in so many countries and with nutrition, with health, with their healthcare systems. It's so different country to country. And like we were talking earlier, you visited India, and that's a complete different story altogether because I have years of experience of practicing in India, and then I come to New York and the healthcare system is two different worlds. So what do you think about the experience and that journey? Can you share a little bit about it?
Yeah, absolutely. So I was in India for about 2 months before my senior year of college. And at that time, I also spent a little time in Copenhagen and London. So during that time period, I kind of was just exposed to a wide array of medicine and how each country operates and what they prioritize. So in a lot of other countries besides here, I noticed that nutrition was one of like the foundational
Right.
milestones of health, and they addressed a lot of their conditions through nutrition, which was like very interesting to me as someone who didn't figure out that I had celiac disease until way later in life. So if I had, when I was younger, when I was getting strep throat and all of these things so often, I kind of wish that I had gone
Right.
nutritionally through my journey, because I probably would have figured that out a little bit sooner. And that's kind of why I loved chiropractic, because it was able to have nutrition, and I was able to do more of like the pediatrics or the perinatal stuff. And I just felt like it was like the perfect culmination of like everything that I was prioritizing.
Makes sense. 100%. You were meant to go through that journey to land where you are. So I love how beautiful and diverse both of your journeys are. But here you are, working together, and you're doing an amazing job with, your location now. And I know it's been growing a lot. I have been stalking you guys on Instagram, like I mentioned, but I can see the work, and that's why I'm one of the fans, and I really appreciate what work you're doing.
Thank you so much.
We love that. Thank you.
Can you tell me a little bit more about like the misconceptions that lie in the field of nutrition, health, and like we were discussing kinesiology, chiro, just in general, there are so many misconceptions we hear every day. Can we elaborate a little bit on that?
Absolutely. I think from a chiropractic standpoint, the start and stop to a lot of it is specifically what chiropractors do. I hear a lot from new patients and people in the community just reaching out because they're curious. And I specifically didn't put the word chiropractic in my branding for that reason. So chiropractors are typically synonymous with chiropractic manipulation. And unfortunately, the vast majority of chiropractors choose to practice that way as well. But what I tell my patients all the time is chiropractic is not a treatment. Chiropractic is a profession. And like any other profession, there's multiple levels of disciplines that one can apply as a chiropractor to help their patients. So I think it's really important to address that fact at first, that spinal manipulation, it is a part of what we do, but it's certainly not all of what we do.
Right.
And if you want to take the nutrition standpoint from that.
Sure. And I think especially with nutrition, I'm very grateful for a lot of the new movement that we shouldn't be getting rid of whole food groups and cutting things out and doing everything on this crazy spectrum, and that, you know, it's a lot of balance in nutrition and not one like size fits all. So for example, what might work for me as a female in this stage of my life is going to look very different than what works for David, and the amount of food we're consuming and the quality of that food based on what hormones we need to target and all of that stuff. So I think rather than these crazy meal plans that sometimes people do where it's just like they can only eat like 2 shakes a day in one meal, I have a very hard time with that as someone who understands that real food is how we should be getting our nutrients, right? Like whole foods. So I think coming from that, we definitely use nutrition to decrease inflammation and all that stuff in our practice, because pain doesn't necessarily just come from one thing and from, you know, overuse. So addressing all of the facets of what can cause pain is really important to both of us.
While talking about the nutrition aspect, I agree with you with a perspective that, you know, a lot of times our goals are like weight loss. I want to lose inches, I want to lose weight, and that doesn't involve healthy way. And most, like we're discussing about pain, we're all pain specialists. Pain can come from so many aspects. That could also be from nutrition, lack of calcium, lack of so many things in our body. I recently realized how important peptides are for your bones, for your hair, for your skin. I started, once I was reading more and I got hooked up to it, I started using peptides, and because of that I realized that I'm doing a little better and I can see that difference. So nutrition plays such an important thing, and that could be one reason why we have pain.
Yes, and even take that a step further. I just had a consult last week with an individual, a young woman who was getting debilitating migraines.
Right.
She had gone under multiple MRIs, had seen different specialists, was currently debating Botox injections, and nobody decided to send her for blood work. So thankfully, she saw a functional medicine specialist who had just sent her for blood work, and she realized that there were a few deficiencies, one being sodium and magnesium. And she's recently been supplementing with both of those, and her headaches are already coming down, and I haven't even treated her yet. So seeing these nutritional deficiencies and how they affect us viscerally, mentally, all of it plays a huge role. And it is not that it's not well understood, but it's definitely not well represented yet in the healthcare community. But things like peptides, I hope, start to turn around so people see that there's so much more than just, you know, NSAIDs and Tylenol and things like that.
Correct. Yeah, we were living in a world where Botox is our first option instead of, hey, let's go draw some blood. That's like the basics. And let's go see if how your lifestyle is. Are you just sitting all day? Are you having any workout? Let's talk about dehydration. You know, those are the things that are being avoided. And we're like, okay, migraines, let's just jump to like Botox. And that doesn't make sense to begin with.
Nope.
Yeah.
I think even just water, like one of the first questions that we both ask is like, on average, how much water are you drinking a day? Because we can do all the muscle work and all the strengthening and all the manipulation in the world, but if someone is drinking less than I like to drink a ton of water, so we are pretty much our body weight in ounces. But we do know there's some people, like we asked someone and she's like, all I had is a large coffee today, and it was like 4 p.m. So of course her body's going to be super angry with her, and her muscles are going to feel super tight. And I was kind of explaining that it's important to, you know, start from the basics, because if you don't have a good foundation, your house is going to fall apart.
That's right.
Yeah. And if we educate most of our patients for these basics, for this foundation, I don't think they'll even have to go to like specialists. They'll just be doing so great, recovering so well on their own. And we need to have that word out, that education out in this world, I think.
Absolutely. Absolutely. I think education is the number one role, and the Latin translation for doctor is teacher. So I think it's absolutely our role to educate the public and allow them to make the best decisions for themselves, but at least give them all of the options, especially as new and different portal of entry providers, as PTs and chiropractors. We definitely sometimes become people's last resort. I don't know if you've heard that a lot, Doc, but I hear, at least once a week, somebody come in and say, I don't really know what you do, but nobody's been able to help me yet. So I hope you can. And in those moments, I just have to take a step back, look the patient in the eye, and just really say to myself internally, what's this person been missing?
Yeah.
And how can I fix that?
Correct. I did not know that the Latin translation for doctor means teacher. That is something beautiful that I learned today. Thank you for that.
Absolutely.
Well, moving on. Tell me about the misconceptions in Cairo and how just one field in general, like we were discussing kinesiology and how kinesiology, exercising, and you are both from sports background. You know this better than anyone, how important it is for you to be active, for you to have your warm-ups and cool down. And missing those steps can cause so many problems. We can touch those topics. That would be great.
Yeah. So I think that's a multi-leveled question, and it's actually an excellent one. So chiropractic itself, let's just talk about the general aspect of chiropractic, which is synonymous with the chiropractic adjustment. And then you have pain science, what the person feels and what they experience. And then you have manual therapy. So that's our cupping, our scraping, our myofascial release. And the average person would tell you they go to a chiropractor, they maybe get a history and an exam, maybe they take an x-ray, maybe they don't. The patient lays down and they get an adjustment. And for most people, because chiropractic, and especially the adjustment in chiropractic, is effective. So generally they have more range of motion and they feel a little bit better. The problem is the fall off to that. The problem is in 24 hours, the problem is back. And that leads us into pain science. So pain science is I walk a mile and my knee starts to hurt. Well, is the problem in my knee? Is it in my back? I'm just not going to walk anymore. So then other issues happen, and then those patients find themselves in PT or chiropractic offices. And then there's manual therapy. So that's cupping, scraping, myofascial release, all of those things, right? So the misconceptions there can be found at all three. One being the chiropractic adjustment is the end-all be-all. Another being is I need to stop moving to feel better. And then the manual therapy aspect is this is the only thing I need because I feel really good in this moment, but it's not actually addressing the problem. Again, it's just making me feel better. So all three of those PTs, chiros, osteopaths, physiatrists, they all fall into those categories in one way, shape, or another. So I think we need to try to bridge the gap, and that's where Optimize really, I think, shines in trying to find the best in all three of those to make the best outcomes for the patient.
I also love the word optimize, how well thought that is, and how you're actually working on giving those results by optimizing body as a whole. And that's really amazing.
Thank you.
Of course. What are your goals and where do you envision your location and your practice going from here?
I'll let you answer that first.
Ooh, tough question. I think that our goal would be to help as many people as possible on a daily, monthly, yearly basis. And partially to get patients to understand that pain is not singular, meaning that it's not coming from one thing. So unless we're addressing all the facets of that pain that we were talking about, whether it's your social life or your emotional health, your spiritual health, your physical health, obviously being super important, but unless we're stabilizing the instability and we're adding movement into the tense muscles, we're only going to get so far. So I think long-term goals is probably, being able to scale out and hopefully, help many people across more than just the Hoboken area. But for now, we're loving where we are.
For me, I definitely live more in the individual moment. Although I have to say the Hoboken community, the Jersey City community, the people that have come to see us are absolutely incredible and blowing us away. But in each individual day, my goal is to just change somebody's day, change one patient's day at a time. change one patient's week at a time, really just one step at a time, and just doing the very best I can for as many people as I can help. And I would really love to eventually bring somebody in to help train them and help them understand these ideas and these concepts, and even beyond just optimize. As a chiropractor and a physical medicine specialist, I really just want to change the conversation as well. I want people to understand something we were talking about before, about how chiropractors are synonymous with a treatment. I would love for all of my patients, when they're out to dinner or they're at a work meeting and somebody says, "Oh, my neck hurts, I need to go get fixed at a chiropractor," I would hope that a patient who had seen me would turn around and say, "Well, that's really just one thing that they do. So what specifically else would you really like them to fix?" I think if we can change that conversation, we then open the doors for so many other practitioners and providers everywhere to make a difference in people's days and people's weeks. So that is something that means the world to me.
How do you, when a patient walks into your clinic, how do you go about it? Because I know you've been practicing multiple things and it's been working amazing. How would you like assess and evaluate and plan the and do the plan of care basically?
That's a really good question. And my patient approach is pretty unique in that I almost interview my patients before I even get into the pain. I really don't address their physical complaints until I've spoken to them for about 3 to 5 minutes, and I get their understanding of what they're thinking of chiropractic is, what they're thinking of healthcare is, and what they've had in the past. Because I think it's really important to know where somebody's been, what's worked for them, what hasn't worked for them, and really if they're apprehensive or not. And I try to level myself and try to put myself in the patient's shoes. And then once I feel like we're on a level where they feel like they're being heard, then I bring them to the back, I have them sit down, and I go through the history, because I want them to understand that everybody's health is very individual. While we do, and I'm sure you understand this too, Doc, a lot of conditions we treat are similar, but I think almost none of them are identical.
Yes.
And I think that once the patient understands that, they go, "Okay, I'm in a good place. Let's figure this out." And then I think when you can get the patient to trust you, you can get them to talk about things that they might not have said, but are just so important into how we can progress. So really, it's a few minutes of just general conversation, followed by some in-depth history, obviously an exam as well. And then if I can treat it on the first day, I will. And thankfully, I haven't had to refer anybody out yet, but I definitely have in my past. And of course, that's scary. But I think getting that feedback from the patient right away, making them comfortable, just makes the visit so much better.
And I think a key point of what makes us a little bit different or has really helped us build rapport is the education part.
Yeah.
So we are very grateful for this conversation because we know you feel the same, but we really do pride ourselves in explaining and educating and empowering. We never want someone to feel like they need us forever unless they want to come hang out all the time, but we want to give them the tools to succeed and feel optimal in their own body. Right? So that education portion is huge on our day one. It's in our everyday, but especially on our day one, getting someone to understand that what they're going through is unique to them, but also something we can help with.
Yeah. Are you familiar, Doc, with the CRISP protocols?
CRISP.
Yeah, it's actually a chiropractor. He wrote a book on basically pain science, manual therapy, and physical medicine. And it just popped in my head when you asked me this question. The 3 things that I say to myself subconsciously are those 3 protocols. So it's, what are these patients' values? What's important to them? What treatments or what benefits do I think I can provide them? And what does the evidence tell me? So that's really my clinical compass. I didn't think about this before, but when I'm talking to that person, I have those 3 thoughts in mind. What is good for them? What do I think they want? What does the evidence tell me will work? And where in my expertise do I think I can best help them?
Dr. I'm so proud of you.
I am. My mind is just trying to understand. Let's break it down. Can you break it down for me?
Absolutely. So those 3 facets, right? So let's start with what's best, or what does the patient feel like is best. When the patient comes in, say it's that grandmother, that 70-year-old grandmother, that the only thing she wants to do is sit down on the floor and play with her grandson for 30 minutes. That's the most important thing for her. So I can say, okay, that's in one category. In category 2, what does the evidence tell me? If this woman is 70 years old, does she have arthritis? Does she have comorbidities? Do I need more information? Was there a trauma? Has there been any trauma in her past? So what is best for the patient? What does the patient want? And then what does my clinical compass and the skills that I provide, whether it's manual therapy, active release techniques, stretching, physical therapy, exercise, everything in my wheelhouse, what do I think is best for this person to match what I believe they want?
Okay.
And what does the evidence say is going to work best?
The first, when you the first one that you mentioned, I thought it comes from the past. Does it also involve what they have had, what therapy they have had in past?
Absolutely.
Uh,
So that's part of that as well.
right.
So in that 3 to 5 minute conversation, I'll ask, so what have you done in the past? Whether it's the same issue or an older issue, have you seen somebody? Have you seen a chiropractor, a PT? Have you done injections? What kind of clinical compass have you had? Have you gone to an urgent care and they gave you a muscle relaxer for a week and then you've been taking Advil ever since? So that's all part of that, what's going on with the patient, right? So that whole picture where I can try to match what does my background and my training tell me is best for this patient? And then, of course, going by whatever the literature is saying is really good too. I think is very important. So I try to stay up to date as much as I can. Obviously, I try to not fall into habits, but I definitely have my favorite treatments. But you know what? We're here to be challenged and to be pushed. And every week I try to read at least one paper and I find something that maybe I shake my head at and I say, oh, I don't know if I agree with that. And then I read it again and it makes a little bit more sense, which I think is great. I think as practitioners, we need to hold ourselves accountable to be challenged in beliefs.
Makes sense. We have something called a SOAP protocol.
Mm-hmm.
I think yeah, that's how you do the notes.
Yes.
You know how much we love doing notes.
Oh, our
we
soap
do.
notes. We know them very well.
I love doing patients. I love seeing my patients. Like you said, we keep, it gets boring sometimes. When every day you're making them squat, do variations. That's only how much they're gonna do without being tired. So I like to come up with like games and introduce sports with like yoga ball. We'll do kicking and we'll do throws with the ball, and we'll add on weights. Just focus on elbow or shoulder. So we'll do a few games, ladder exercises, a few things, and then we'll sit and talk. So us with the patient, we're like having a nice chat, and then towards the end, when I'm all like done and satisfied with the day, with the work that I've done, I come sit on my desk, and our sweet front desk, they just look at me and they're like, notes.
I love that, Doc. That is so relatable. That's her for me.
I am the person that reminds him to do his notes
we're not fortunate to have a front desk staff yet, but we'll get there. So I have her. She sends me a text. We close at 7, usually 6:45. Oh, you finished for the day? Great. Do your notes.
Don't until your notes are finished.
Oh yeah.
I love that. But yeah, it's fun. It's lovely what you explain and the way you walk through the patient, and like we're talking how it's different for every individual. A lot of people don't understand that, and they feel I wouldn't say depressed, but they do feel demotivated when they don't see the results compared to other people around them. So educating them like, hey, your case is different, your intensity of pain is different, what you're going through is completely different, the mechanism of injury, everything. That's really important. How do you keep your patients motivated, like other than education?
That's a great question. So I really like the example that you used, playing games. What I like to do is simplify an exercise, even if it's painful, and that goes back to pain science, right? Mm-hmm. So the way that I approach exercise, if the goal is to do a squat, right, but we have an acute lumbar disc injury, physically the patient may be apprehensive or afraid to go into a squat. So I try to break down the motions of it, even if it's just tilting the pelvis and that's it, or just slightly bending the knees, or just feeling comfortable. It's finding little goals and milestones in each visit for the patient, and then reassuring them that their journey is completely different. Sciatica is a great example. Obviously, as you know, it is widely used. I'll have a patient come in and tell me I have sciatica, and then they'll point to their arm. So obviously, that's something where people just like, oh, I have sciatica. Oh, I have sciatica too. But depending on a patient's circumstance, we can help it in one visit, or it can take 2 to 3 months, or in some cases they need higher escalation of care. So again, that really comes down to understanding the patient, getting the patient to trust you, that they're not going to just go to their friend and say, why am I not getting better and she is? Well, if that's the case, then you failed as a doctor to really figure out exactly where this is coming from and exactly what the patient's goals and expectations are or comorbidities are. So I think it's extremely important that you just have a realistic understanding and communicate to your patient really well about where they are and where they think you are. As my Luna, my favorite patient.
She's knocking on the door.
I heard that.
Yes, the
Her,
dog.
her name is Luna.
It's Luna.
How many dogs you got?
We actually have two. We have Kylo, who's 7, and he's, a mutt. And then we have Luna, who's our little Labradoodle. Both rescue. They're the best.
So, what is up for grabs?
No. One was rescued previously. That's her baby. And then we rescued Luna together, and she's my favorite.
She's up for grabs.
No, she's not.
Okay, I heard that. But I love that. Do the dogs come often to the clinic and just work with you?
So they're there every Thursday. If anyone would like to stop by and see them, they are Chiro Pup assistants on Thursdays, and sometimes more often, depending upon the weather and how easy it is. It's been a rainy season in Hoboken lately, so we've been trying to not bring them so that wet dog in the office, big thing. But.
Do you give any home exercise programs to your patients?
Absolutely. I always say that I give really easy homework. And I think that's just a little cue that makes the person feel a little bit better. But I do anything from band work to dead bugs to psoas activation, a lot of knee exercise, knee strengthening exercise. So I would say it's general, but highly specific at the same time. So I try to keep it as surface level as possible, because I think you can give somebody a really effective exercise, but if they can't execute it or they don't see the value in it, they're not going to do it. So I say, I'd like to be generally specific with this today, and I have them do a dead bug. And I have them do it usually, like say the patient's like, oh, I've done those before. Then I break it down and I change it up just to try to make it seem new and engaging to them. But I found a lot of success in simplicity when it comes to that. Obviously, depending on condition, but whether it's a fencer, TheraBand activation, a lower trapezius activation exercise, or a bird dog or a bridge, I think that also really reiterates to the patient that they're an active participant in their healthcare. So I try to give exercise to absolutely everybody.
Yeah, we pretty much do it all too. And I feel like lately, especially, I've been seeing more of the women. So a lot of them have been coming to us with, they feel like it's pelvic floor issues, which they're not wrong, but they think that they have a weak pelvic floor. But I've seen so many of them experiencing tight pelvic floors, and they're doing all of these things to tighten an already tight muscle. So a lot of, determining what exercises, and then honestly, which stretches to give people too, because you can strengthen all you want, but if you're not allowing those tight muscles to lengthen before we strengthen, then we're only going to get so far. So a lot of homework from us, but they're usually pretty easy.
I love that.
Always easy. Generally specific and easy. As it's not confusing enough. But
we're walking into a world where COVID happened and a lot of things went online. What are your opinions about telehealth?
That's a great question. I think it has a place. I definitely do. I think for people, whether it's they don't have a car or nobody to drive them, I think the fact that they can get on their iPad and speak to a physician or a therapist or somebody that is well-intentioned and can help them is an absolutely beautiful thing.
Right.
I think that's fantastic. Even if it's just somebody to listen and to try to help them understand. Just to take that a step further, I'll put the onus on the professional that if they're registering that this person needs a little bit more, I would just hope that those practitioners step up and say, I really hear you. I think this is what's going on, but I think that somebody should be with you in a room, take a look at it in person and see if there's something. So I think it's a beautiful thing. I do think it's taken advantage of, but as long as it's well intentioned, it can only help.
Right. 100%. Do you do a lot of telehealth at your practice?
We do not. I will get on the phone, so I'll have some leads that have a few questions, of course, whether they have preconceived notions or they just want to understand. So I will have phone conversations with people, and generally people are really pleasant and nice, and they'll ask me questions specifically, and I'll always point them in the direction of, well, this is my recommendation, but I really don't want to give too much input until I can actually see what's going on, feel the joint, just to get a better understanding. And usually people understand that.
I love that. How does the combination of practice work with nutrition and
Mm-hmm.
Cairo comes to cupping, exercise manual? How do you combine the whole treatment session?
It's a good question. And each visit is truly unique. And I tell people that on the first visit, depending on what the patient feels or what I think the patient needs, it changes. So it's not like I'll have the person come in on their second visit and say, okay, we're going to cup on the third visit and scrape on the fifth visit. It's really individualistic to the condition.
Okay.
And usually it's organic. The patient will walk in and they'll say they were doing a lot of tricep work in the gym and their arm is hurting them. So I'll say, oh, let me look at your tricep. I'll evaluate it. And I'll say, hey, this may be a fascial issue. I think scraping would be an excellent choice here. Or the person had just driven maybe 5 hours down to the shore or drove back or was in the car for a long time and their lower back was a little bit flared up. I would say, why don't we treat this today and then do some cupping just to help everything relax and speed up the healing. So that's really how it goes, at least for me. I know Cassandra definitely favors the cupping to the scraping. I'm much more of a scraper.
I
Dealer's choice there.
Dealer's choice. I am definitely a little more of the nutrition conversational based too. So I think that's partially where the cupping comes in too, because I can have very intentional conversations while someone is also getting the benefits of cups or recovery boots. I do a lot of our consults and history there so that their lymph is moving and they're getting, exposed to one of the facets that we do have, and then we can kind of dive deeper. I know that sometimes cortisol and stress isn't addressed in pain, and it's a huge factor. So if, someone's mom's in the hospital or they're going through a divorce or their child's sick and they're feeling pain, unless they address some of those stressors too, we can't necessarily get to the root cause. So allowing people to talk through things has been, I think, huge for us.
I love that. How did you come across a lot of women's health and pediatrics?
So I would say that luckily we've just had like a lot of people walking by and like some traffic, and then you get in with the mom group or so, which really, really helps. I am Webster certified, so I think being on that list automatically allows, my name to come up a little bit better with that too, particularly in the mom and children. But we've been seeing a lot of pediatrics lately. Allergy season's really upon us, so I think that's part of it. And then, school sports and all that stuff. Mm-hmm. So we've been really blessed. We have had a lot of families coming in together. So the mom, dad, and kids will all come in together. And that is definitely where I think I at least thrive. And I know that he appreciates it too. But seeing a family as a whole and wanting to work on their health as a unit has been like super special.
Yeah.
I love that. It is so wonderful to hear about your experiences and how just people walk into a place and feel so comfortable that they can get their whole family to do a session with you together. That, trust me, requires a lot of trust and faith in a therapist, in a practitioner to put into, and I love that they trust you with it. That's
amazing.
Any thoughts or any words of advice that you would like to put out there for our viewers today?
Yeah, so my first piece of advice, if you're thinking about getting into the field of chiropractic or PT or kinesiology or athletic training, is to find your own way and not be afraid to challenge preconceived notions or what's popular or the beliefs that you think are beneficial, because what you'll realize is that working in healthcare is a journey just as much as your own health is, and finding your niche, finding the things you enjoy, and just being open and honest to the things that you think work and don't will resonate with people. And obviously, there's the perfect practitioner for every patient, but you can also make best with somebody that truly is well intentioned. So don't put too much pressure on yourself. Study hard, but constantly learn. Constantly learn. Don't try to memorize. I will say the one thing, anatomy is definitely a language, and if you don't use it and practice it, you will lose it.
Yeah.
So for me, I try to look at my anatomy book at least once a week, and I constantly look at it and say, I forgot that was there. And then that same week, somebody comes in with that problem, and I smile to myself. So definitely be yourself, work hard, and be your best.
Yeah, and be open to like changing if the research shows you that you have to change, you know? So things are always coming out and the research is always coming out and the evidence is always coming out. So not to be so set in your ways, like be, you know, strong in your beliefs, but not so set in your ways that you become ignorant.
Yeah. And then back to the more patient side, don't be afraid to have that conversation. If there's something that you're questioning with your practitioner, or if there's something that, you know, is holding you back from seeing that practitioner, definitely just feel free to call and reach out. Doc, I know I get that vibe from you almost instantaneously that you're welcoming and you want to have a conversation and get to know somebody. So I would say, even if you think maybe this is something they can't help, all the practitioners that I know are more than willing to just get on the phone and just talk through it. So especially me. So if there's any patients out there that have something they're questioning, feel free to send us a message, and we'd love to have a conversation and just see if we're a good fit, or if I can point you in the right direction. I absolutely will, because so many people live with pain that frankly they just don't need to have. So I'd love to make a difference there as well.
I love that. That's beautiful. You can see the intentions in the way you're talking and the way you're carrying your practice. You can see the pure intentions, and you're out there to be the difference, you know, be the change and make society a better place. And it's beautiful.
Thank you so much.
Thank you.
Thank you guys for taking the time out and speaking with me. I'm so happy and excited for your wedding, coming up wedding.
Thank you.
I will stop by to meet Luna and maybe grab her.
We'll do the next one live, and we'll have the puppy assistance as well as part of it.
Well, good night to you, and I hope to see you guys very soon.
Good night.
Absolutely,
Thank you
doctor.
so much
Thank you for your time.
Bye. Take care.
Bye.
Thank you for listening to our talk about health. You can follow me on Instagram at bhavna.devnani, on Facebook at bhavna devnani, and we'll leave all the information in the description below. Thank you.